Hello, I'm Woodrow Wilcox. I'm the Senior Medical Bill Caseworker at Senior Care Insurance Services in Northwest Indiana. We're the largest senior citizen-oriented insurance agency in the Midwest. For over 8 years, I've been helping senior citizens to correct medical bill problems, and I want to talk about the effects of ObamaCare on senior citizens who use our agency for their health insurance needs. First of all, there are various problems with ObamaCare. It caused $500 billion in expected medical benefits for senior citizens to be transferred to other things and other people. In September 2010, children with pre-existing conditions who did have health insurance lost their health insurance because of sloppy and stupid wording in the ObamaCare law. The Wall Street Journal on March 9, 2011 had a story which showed all kinds of problems with ObamaCare, including now a need for thousands of citizens across America to get a prescription in order to buy aspirin. In Accounting Today, the September 22nd, 2010 edition, the editor-in-chief, Michael Cohn, wrote a story about how ObamaCare rulings by the agency that oversees ObamaCare keep changing the rules and frustrating doctors, and it's causing many doctors to leave the Medicare system, which is going to make it harder and harder for senior citizens to find doctors to treat them and using the Medicare system. Now, since ObamaCare was enacted, new rules and new rulings from Medicare have come about that have hurt seniors. And I realize this because one of our clients had benign lesions, and before ObamaCare rulings started coming down from Medicare would always go ahead and help him with paying for treatment of benign lesions. But after ObamaCare came into effect and new rules and regulations came into effect, now Medicare is refusing to help him pay for treatment for benign lesions. And that person has an amputated foot, so he needs the treatment. This is not make-believe medical treatment. He really needs it. And we have another client that Medicare has refused to help pay for treatment of benign lesions. A Valparaiso woman, a woman from Valparaiso, Medicare refused to help pay for x-rays that related to her mammography. And a Lowell man, a man from Lowell, Indiana, had an x-ray before surgery on his chest so that the doctor could see what was in there before he went in to perform the surgery. And Medicare has refused to pay for that x-ray of the chest. And even so, the doctor wrote a letter saying how that x-ray was absolutely needed as a medical treatment because the doctor would not have performed the chest surgery without first seeing the inside of a chest with the x-ray. And still, on appeal, Medicare ruled that the x-ray of the chest prior to surgery was not medically necessary. This is an illogical rule by Medicare. We have another client. A woman went to a local hospital and the doctor there said, you know what, we don't really have the facilities to help you the way I think you need to be helped, and your doctor is at another nearby hospital anyway, and he's more familiar with your health history, so we'll have an ambulance take you from our hospital to the other hospital. Well, Medicare has refused to pay or help pay for that ambulance transport of a patient from one hospital to another hospital for necessary treatment. Now, the woman died later on. So this was a necessary treatment, but Medicare refused to pay for the hospital transport. And even then, a doctor wrote a nice letter saying this was absolutely necessary for the treatment of this woman. In the appeal ruling, Medicare ruled that it will not pay, has a policy of not paying for ambulance transport from a hospital to a doctor. Well, that completely ignores the facts of this case. So Medicare made a ruling against the client without even considering the facts of the case of being transported from one hospital to another. They said, we won't pay for transporting a patient by an ambulance from a hospital to a doctor. They totally ignored the facts. And more this is coming about, that Medicare is ruling against senior citizens. Senior citizens expect Medicare to help to pay for their necessary medical treatments, and Medicare is more often than not now refusing in many cases. Through our agency, and I'm sure this is not the case just in Northwest Indiana, it's happening all over America. Just as Medicare has been jerking around doctors, as was reported in Accounting Today by Editor-in-Chief Michael Cohn, they've been jerking around doctors, discouraging doctors regarding the Medicare system, while they're making ridiculous rulings concerning the medical needs of senior citizens. And my point is that Obamacare essentially is now starting to ration health care against senior citizens. You know, in the arguments for the Health Care Reform Act, they said health care should not be rationed. Well, Obamacare is rationing health care against senior citizens. And it's causing a chilling effect in two ways. First of all, it's causing a chilling effect because if senior citizens think they're not going to get help from Medicare to get a medical service paid for, they're more likely just simply to forego going to a doctor or a hospital for the medical treatment that they need. Second of all, Obamacare is discouraging doctors from participating in the Medicare system, and that is going to cause more and more doctors not to serve senior citizens through Medicare, and that's going to make it harder for senior citizens to even find a doctor to treat them for their medical needs. And this is how Obamacare is hurting senior citizens all across America right now. Now, when I discuss this and point out these problems with Obamacare, some people ask me if I'm a Republican. And I'm not. In fact, I'm an elected Democrat precinct committeeman. But I just simply care about senior citizens, and I care more about public policies and political policies than I care about party labels or political parties. I want to point out that the Democrats who voted for Obamacare hurt every senior citizen in America, and seniors will eventually realize this by the 2012 elections. It will hit Democrats like a tsunami wave hits Japan. And Democrats in the House and the Senate voted for Obamacare without even reading the bill, and that was a dereliction of their duty. Now, Harry Reid and Nancy Pelosi said, just vote for it, just vote for it. Don't read it, just vote for it. And when they voted for it without reading it, they performed a dereliction of their duty because they swore an oath to protect the Constitution of the United States against all enemies, both foreign and domestic. And they also told their constituents that they would serve them. Well, how can you serve people and how can you fulfill that oath of office without reading and studying a bill and offering amendments to correct any mistakes? Voting for a bill without reading it is like being a kid in high school or college and turning in the first draft of a term paper without reviewing it and editing it. If you turn it in like a finished product when it's only a first draft, it's going to have a lot of stupid mistakes in it. And Obamacare has a lot of stupid mistakes. For instance, what does hiring thousands of new IRS agents have anything to do with health care? It doesn't have that, but that's in the Obamacare bill. What does getting a prescription, why is getting a prescription from a doctor necessary in order to buy aspirin? But that's in the Obamacare bill for thousands of Americans. And thousands of children who needed health care and had health care lost their health care because of stupid and sloppy wording in the Obamacare bill. So my point is that I'm urging every Democrat in the House and in the Senate to fix this problem by voting to defund Obamacare and then voting to repeal Obamacare. Because that's the only way you can redeem yourself to senior citizens and people who care about senior citizens and don't like these problems that Obamacare is causing senior citizens. Sooner or later, the senior citizens will figure this out, and you better be ready for their anger. And if you don't vote to defund Obamacare and vote to repeal Obamacare, you will deserve the tsunami of voter anger that comes towards you in 2012. But let's not wait until 2012. Let's fix the problem now. And some people may say that I'm a Democrat who's a turncoat, but that's not the case. Think of Harry Truman. He exposed that Franklin Delano Roosevelt's administration and Democrats were allowing contractors and unions to cheat taxpayers on contracts. And I'm just alerting people like Harry Truman did.